We actually teach a class here at Blue Haven on how to do lip fillers, because a lot of people think that when you're doing lips, it's only to put fillers in, but no. So let me give you a bit on my experience. So I was trained initially in facial aesthetics in the UK. Then I did another course where I was recertified on facial aesthetics and body aesthetics in the US. Now, both areas, they do it completely different. How they do lips in the UK was a more pontate, where you go into the body of the lip and you inject, then you go again, you inject, go again, and you inject. Now, that method, you have more inflammation, more bleeding, more swelling, more trauma, and you won't have an as even distribution. Now, the way they did it in the US was you entered from the oral commissure and you went across the body of the lip, and then you would fill, retrograde, antegrade into the body of the lip. Now, I actually prefer that method because it gives you a realistic feel to the lip, a softer feel to the lip, whereas the European approach would give you something like a lumpy grape appearance. You have to look at all of these things when you're going to be doing your assessment. Now, here at Blue Haven, we actually go through a whole list of things that we're going to assess just when we're going to be doing lip fillers. The patient I mentioned that came in a few days ago, she ended up not getting lip fillers because she was not the right patient. What she ended up getting was some Botox. We have to have multiple tools in our toolbox, and that's where we can help treat our patient and give them exactly what they want. You have to assess the patient to know what are their goals, their objectives, what sort of look are they going for, and especially if it's your first time treating a patient, as a practitioner, you want to go slow. You want to use very small volumes, and you may want to do that patient over maybe a 2-week period. So they come in today and you put some in, and then you bring them back in 2 weeks, and then you do a follow-up. You may even want to use other things like PRP or stem cells into the lips to also help. Going back to the geometric face, you don't want the lips to be too big in proportion to the rest of the face. So you have to respect the patient's anatomy. You also have to remember that there are certain contours, ligaments in the face that no matter how much filler you put in, you will not distort. So if you're looking for a natural approach, gold standard that we adhere to here at Blue Haven, after you've done a treatment, nobody needs to be able to point at you and say, oh, you have lip fillers. Because if they could do that, that means I didn't do a good job. Someone should just look at you and say, oh, you look refreshed. You look as if you're just coming off a vacation or you're rested. Not, to signal you out and say you have a botched job. So that's not what we do.